Hello, welcome to everybody to our chat today live with Dr. Cameron Bigge. Dr. Cameron is out in Northwest Washington, did you say, Dr. Cameron?
In Anacortes?
Oh, and sounds like it's a really beautiful area out there.
Yeah, it is. It's spectacular.
So you are a CBP doctor, and you were recently at one of the week-long seminars, and that was your first experience with an iTrac unit?
Yeah, last year I took the basic seminar about this time last year and met Dr. Nichols and got to know him, and he educated me on the iTrac. At that point, I was completely new to correction chiropractic, and so it was overwhelming with how much technology and knowledge and expertise in structural rehab there was in the chiropractic community. It was inspiring and something that I wanted to learn more about.
Excellent. So you've been using the iTrac now for about, you said 6 months?
Yep.
And in that time frame, what were the challenges you were experiencing in your clinic that required you to search for a more advanced cervical traction system?
Looking at people who had just chronic tightness in their upper back and upper back pain, and just their posture was poor, and was kind of frustrated with the limited knowledge and application of skills to be able to help them in a long-term correctional aspect. So to correct the problem of forehead posture, and I was just continuously seeing it over and over and over again, and so I wanted to know if there was a way of fixing that, and that led me to CBP, and then ultimately to the iTrac.
Excellent. And in your journeys, now that you had the iTrac and you've been using it in your clinic for about 6 months, was the iTrac easy to integrate into your clinical protocol?
Yeah, it was definitely compared to the old compression extension two-way traction with using just weights and pulleys. People were very they liked it at all, and they felt like it couldn't handle the stress that it was putting on their neck. And with the iTrac, it's very gradual. You can program everything to the quarter of a pound, and people really, they tolerate it, definitely almost to a point where some people kind of enjoy it.
We've had that comment a couple of times where they've had, when their patients sit in the iTrac chair, that they feel more relaxed and very comfortable, and it's very easy to do a treatment with them on an iTrac. So we've heard that a few times. Changes have you seen in your patient compliance since integrating the iTrac therapy into your clinic?
People who want to attain correction and attempt to correct their spine and their neck, using the iTrac, they're all about it.
What type of patients are you typically seating in the iTrac chair for treatment?
It seems like a lot of middle age and younger people, so 20s to 50.
And you're treating with chronic headaches and forward head posture.
Yeah, ultimately, forward head posture is the structure. They have abnormal structure in the neck, some sort of reverse cervical curve, or whatever the case may be. But anything from MS to headaches, neck pain, numbness, tingling, burning down in the arms, hands, and fingers. Yeah, a lot of different things.
With those patients that you're using the iTrac on, have you seen greater patient results than you have in the past with other forms of treatment?
Yeah, absolutely. Yep, there's a lot quicker because addressing the structure. at a deeper level, at a more core level. People get quicker responses to care in with the traction and the adjustments complementing each other. Um, People get more relief quicker and it stays away.
Excellent. So what has been some of the feedback you've heard from your patients who have had greater results and are feeling better?
They love it.
They love it.
Yeah, they're having a great time.
What would you say that 3 of your favorite features on the iTrac are, and how do they benefit your patients in your clinic?
Yeah, I think the red button, that's a huge one.
The patient safety switch?
Yeah, yeah. You just joke around about it being like an ejector seat button, or just. But yeah, ultimately, it's their comfort level. They're the person in the chair, giving them that thing that they're in control. If for some reason they need to, tap out or get out of that machine and stop, then they have that capacity to completely stop right away. Other features, 2 more, are the adjustability of the 2 fulcrum arms, the traction and the fulcrum arm. I guess the traction arm and the fulcrum arm.
Yep.
And how adjustable they are. So, yeah, and then the last feature I think is how it progresses, and it just eases into from 0 to ultimately the end is the 13 pounds and 7 pounds, and so how it just progresses through that whole from 0 on to the end of the treatment. So creates relaxation, patient comfort, and compliance.
How would you encourage others to incorporate an iTrac therapy system in their clinic if they were thinking about one?
Yeah, it's not about the money. It's about the patient and providing the best tools, and this is the best tool for cervical extension compression traction, or 2-way cervical extension traction, I believe. So yeah, patient comfort is number 1. And they're trusting you, and this is it's FDA approved. That has it's eye-opening kind of wow for people, because they understand FDA is a big organization. They might not know the specifics of it, but they know the name. Yeah, it's awesome.
So you said a little bit, don't worry about the money, because I know the iTrac therapy system can be a little expensive because of the technology that is built around the unit. Did you feel the burden yourself in your own personal clinic when you purchased the unit, or were you able to absorb that upfront and really realize the benefits of it and make it worthwhile piece of equipment for your practice?
Yeah, just the first person that I was able to help with on the iTrac was someone who has had MS for years, like 10 years, and reverse cervical curve, just awful cervical structure, and just within 8-10 sessions, and she was blown away by how great she felt, and her headaches and her neck pain and her MS symptoms and her fatigue and everything was completely diminished. She was someone who experienced the power of working on the structure at that level, that yeah, so it was pretty amazing to see in just a short period of time the impact that it can have on someone's life, and that in itself, is totally worth it.
Excellent. That's a really great story. I hope that others, listening in today and sharing this video with us can really understand what you're saying and feel how powerful this unit can be and how impactful it can be for your patient. So, Dr. Cameron Bigge, I really appreciate you taking a couple minutes with us today sharing your story and sharing your success of your patients and the results of your patients, and how you've incorporated iTrac therapy into your clinic. And we look forward to hearing more blog posts from you. The newest one is yet to come out, I believe, next week. We're going to go publish that one, and I think that'll be a great story to share as well as your video story.
Thank you very much, Lisa.
Yes, thanks for chatting with us today, Cameron.
All right. Have a great one.
Bye-bye.
Bye.